and the chilliness was there, and the itching had tremendously increased. And he said that now I'm unable to do my work. So in spite the symptoms are better, but the work desire, the work capacity has reduced. So this was again a bad sign. And the inhaler need is continuously there. There was a full moon aggravation which I could observe now, but still the chest was always clear. And he said ki I have wheezing in the morning and I have to again wake up, and I feel better only after 10 o'clock when I complete my breakfast. So this was where everything was going in wrong direction, but my overconfidence was coming in between. And this is where we need to assess ourselves and have all the radars in your hand. I don't know why I missed this case for so long. Otherwise, the radar we selected because sulfur acted as a partial simillimum, and the patient started feeling better at the complaint part. But after 2 3 months he went into aggravation, which was a very bad aggravation. His sleep cycle got disturbed, which was not disturbed before. And then I understood the whole case, the complete totality, that what is important for this man, for what this man is surviving, and where he has got this hurt. So definitely I took into consideration his anticipatory anxiety. I took into consideration his work desire, his industrious attitude, or his defense mechanism, that he wants to keep himself busy. He wants to work so that he can forget his anger. He can also forget his complaints. He cannot skip a single day of his work. He is very sincere. In spite of so many complaints, in spite of physical difficulties, he is still continuing to the work, because he has to complete the pressure at any time. And when I asked why, because he said काम खत्म नहीं होता तो और रात हो जाती है, ऐसा लगता है कितना सारा काम बचा हुआ है। और मुझे टाइम पर का प्रेशर रहता है, काम का प्रेशर रहता है, सभी की टाइम की डिमांड होती है, तो मुझे ऐसा लगता है काम जल्दी खत्म होना चाहिए। दो आई एम चिली स्टिल आई वांट फैनिंग। And was the time when I reassessed the case, giving the right constitutional simillimum over here. After that, the whole constitution has really changed. In spite of pressure, in spite of pressure of EMI, there is no anxiety, no ghabrahat, there is no breathlessness. The lumbar pain, extremity pain had gone down. And last follow up when he said ki he said that now even if I take one stroke of one inhaler, I am much better, and this the habit I will break now. There is no anxiety, no wheezing. Only anxiety is that I have to repay the loan now. The work pressure is there, और मैं बहुत ही सारा काम कर रहा हूँ विदाउट एनी ब्रेक सिंस लास्ट 3 days। इसके कारण थोड़ा सा मुझे बैक पेन हो रहा है, बट दिस बैक पेन इज नॉट इक्वल। ये मेरे थोड़े हाथ पैर दुख रहे हैं, पर मेरे वैसा नहीं है जैसा पहले होता था। आई एम फीलिंग मच मच बेटर, माई कैपेसिटी ऑफ वर्क हैज इम्प्रूव्ड। एंड इन स्पाइट ऑफ 3 days वर्कलोड, मेरे दुकान पे लड़के नहीं आ रहे हैं और मुझे अकेले संभालना पड़ रहा है, but still I am better. So this was the whole case with the follow-ups which I have shared with you all people. And coming to the totality, yes, the most important keyword when you talk about bronchals is definitely anticipatory anxiety. I took anticipatory anxiety with forsaken feeling because this was the hurt what he said to his whole case. So this is the analysis of the case, that he is a person who is family oriented, he is introverted, likes to be alone, he has conflicts within his own family, disputes with the siblings, there is a property issue, and after that property issue the life has really turned topsy turn. There is fear, there is image consciousness, that is a tint of esteem is there, we can see. The anger which was very violent before, now there is anger suppressed. There is a sensitivity part with weeping alone. He has attachment to father, to mother and daughter, and he feels sensitive weeping for them. Then he's sympathetic, he cannot see others in pain, he's responsible fellow, he's working very hard since he has taken the responsibility, and early responsibilities came upon his shoulder. He has to give away his ambition too, but he is not in a way of blaming others, but definitely he has channelized himself, his whole journey of life with work desire. He's workaholic, he stands strong, want to be tough, as being guided by mother. He has anticipation for future. He has got leadership quality with good intellect, mechanical creativity, ambitious but left in between. He feels that there is lot of injustice with him because he has suffered wrong in spite of not committing a mistake, deceived by relatives he feels, and after that he has developed hatred, no relationships now, disappointment from brothers because they have not supported him during his tough time. He feels lonely, he is workaholic, there is territory issue, anxiety about health, the anger which is reducing now, he's sincere in work, desire to be alone, decision can take. There is a factor of reproaching himself when he says ki every disease whatever I'm suffering is because of the mistakes which I have done in my past, and now I don't want to repeat them. So there is a taint of reproaching himself. He has grief upon the death of relatives. There is a silent grief which he cannot express. He feels very lonely, and he is really sensitive to criticism because he does not want anyone to point upon me, and therefore he wants to finish all work on time. He's definitely an obstinate fellow because if he takes into consideration, he has not bent in front of the relatives anywhere. So need support of parents, he always had that longing for love and support from the parents which he is still missing. He finds that support from his family, and he's really very affectionate and caring towards his family members. So this is the totality, that there is anxiety, anticipating, forsaken feeling, and with criticism and all, I have taken a broader rubric of being getting offended easily, which will cover his anger aspect also. And there is a rubric of anxiety concerns of, because he feels that the anticipation whatever he has, he does not want to commit a single mistake in his life, so that future is getting spoiled. So there is lot of anticipation, that reproaching self को ज़्यादा anticipation में लेंगे अगर, तो anxiety concerns of is there, along with reproaching is also there. Now the remedy is there in the box. If anyone wants to come up with the medicine, if anyone has read the materia medica thoroughly, will really pop up with the medicine. Natromure went wrong. He's chilly, lean thin personality, so carbons are ruled out. Anyone? Meadow 200. He why Meadow? I did not. I said ki he is lean thin personality with proper built up. There is no ugliness found out. There is no clairvoyance which is there. There is no out of proportion anything. Arsenic, he is not very fastidious. If I say he in the whole case, you did not find anything which was very particular or fastidious about. He was very naughty, very chubbly in the past. Even in work right now, he's more of hardworking rather than, he never said I want work to be done according to me and my willpower. Aurum will be ruled out because he has not worked for the society. He does not have that high ambitions for the society. He's still struggling his life for his own world and work. And carcinosin, carboveg, I will say carboveg, they are definitely slow sluggish, and when inflammation goes into sluggishness, then carbon group comes up, a very beautiful remedy. But here still the key stage is of inflammation. Carcinosin is will have lot of domination. If you see the childhood, there is no domination history. Silicea, yes. Why Cilicia? You have to reason out why Cilicia. If anyone wants to say Calcarea, Natramars, then you have to give the reason for Natramars, give the reason for Cilicia. Just because Cilicia is left out is not that Cilicia is there. Why Cilicia? Why Calcarea? Someone said Lycopodium, but Lycopodium has to be very manipulative. He was not ever manipulative. Therefore, he had suffered. Even if he would have manipulated, he would have taken up the ज्वेलरी ऑफ वाइफ को कहीं छुपा के रखता था, कुछ करता था, वो दिखाता था नहीं. मैनिपुलेशन उसने कहीं भी नहीं किया. and he is not that timid with soft on inferior, and hard on inferior with soft on superior. So lycopodium taint was not there, he's not that dominating also. So if anyone wants to give calcarea, why calcarea, and if anyone wants to give silicia, then why silicia? Dr. Sheetal ma'am, can you tell me, Dr. Rashmi, Dr. Gayatri, why reasoning for silicia? Silicia, because patient is punctual, hardworking, sensitive. There is anticipation, diligent in spite of not feeling well. Yes, this is one of the feature for entering into Silicia. Yes, definitely. But what are the other factors of Silicia which is there in the patient? There was one rubric which I could see when I was talking about bronchus. I told you it is somewhere in the family, so I got the exact rubric. I will give you that rubric. It is really an interesting rubric which I added to the totality, and the rubric was forsaken feeling beloved by his friends, parents, and family members. So the remedy came up was calcarea and silicia. This was the rubric exactly describing the whole emotional pathology of what we have learned. The rubric is exactly what the bronchioles or the bronchus spasms talk about, that there is a forsaken feeling, there is longing of support from the family members, friends, and parents, from whom you expect that they have to stand for you. And this forsaken feeling gives you is there in and out in this case, because he has told you 10 times that everyone was standing on one side and I was on the other side, and there was no support. And even what instinct the mother has given to the पेशेंट वॉज कि दुनिया में कोई किसी का नहीं होता, तुझे खुद के दम पे खुद का खड़ा होना पड़ेगा. This was where the sora has shifted to psychosis, because mother also gave him the same thing कि कोई किसी का नहीं है, तेरा भी कोई कल नहीं होगा, ऑलरेडी तू अकेला है और कल भी अकेला ही रहना पड़ेगा, इससे बेटर है कि तू अपने आप को मजबूत बना. सो दिस वॉज द वर्ड वेयर actually the whole history has changed and turned around when you see where the sora shifted to psychosis. And this was where I have taken the rubric is forsaken feeling beloved by his friends, five friends, feels is not being. See, this was not when I have taken the whole case. This was the rubric which I found today when I was reading Cilicia, because Cilicia really helped him out. And when I was reading, going through the rubrics, I found this rubric, and exactly this was the state of the patient. I do accept कि every time it is not that this is the whole rubric on which I have prescribed. Yes, even I entered into the case that he wants to work in spite of not getting well. He has that forsaken feeling. Yes, I took forsaken feeling. He felt of being left alone. This all I have taken. I have taken reproaching self also when I prescribed Cilicia. But when I was reading Cilicia today, from elements of Shankaran sir, to my surprise, the things were like, when we talk about Cilicia, we talk about more of work, we talk about more of responsibility. But you know what he has talked about is, when you talk about Cilicia, it is about blood relationship, family members, it is about family image, it is about father, timid and fragile personality, obstinate, family minded personality. The person is demanding, he feels being indignated, he has that victimized feeling or being abused in the family members, and he has that selfishness attitude which is there, and a feeling that he is being trapped somewhere. So this is what Cilicia is, and this is what we get, that using your own family for your own gains and demanding attention from your father. Father is a victim, a selfish family members around you. The family image should not be polluted. His timid personality, obstinate, and feeling of indignation which is there. So fragility about abuse, and he is the person who is spineless, who has to bend down. Silicia also come up as a spineless remedy if you see. So they want support of others, and without the support, they feel that they are very fragile and they will be broken into pieces. So they are really very sensitive internally. If you see that glass is made up of silicia, and if you see sand in your hand, it is so fragile, you cannot hold it in hand. It really tend to fall out of your hand, but it's still firm, it's tough somewhere, and if it is given a good support, it can really concretize itself and stand firmly like a structure of this whole building what we construct out of this silica material. So definitely silicia has helped him a lot, and after prescribing silicia, all his complaints have really improved a lot, and he is having the other features also. You read silicia from elements and you will see that the case is really covering everything. This is not about more of diligency but more of responsibility which I could feel. And I really entered because he has lot of anticipation. If you see the childhood, you will see that he was anticipating getting not feeling well when he got less marks. He expected good from him, his performances. He has so much of anticipatory anxiety, which is really the core of Cilicia. The other remedy, Merck, was also there, but Merck acted very badly because the anger of Merck is not there, therefore that was a wrong medicine. Sulfur does not feel that he is alone, and this patient really had that 4 second feeling and alone, left alone in this world after the parents were gone. And that was the time when his complaints had also started. So this is where the loneliness has affected him, and what impulse the mother has told also, that you have to stand alone, you have to fight this world alone. So this is the environmental impulse which the patient has got. If the patient would have not been silicia, if it would have been sulfur, he would have not got affected because of this loneliness, and he would have not even uttered these words in the case taking. So whatever the patient is saying during the case taking is what he is really suffering. आप 2 घंटे में पूरी लाइफ हिस्ट्री किसी की नहीं ले सकते, पर जो चीज वो बात कर रहा है, जिस चीज के बारे में वो बोल रहा है, इसका मतलब उसकी वो सेंसिटिविटी हर्ट हुई है। तो वो बार बार किस चीज के बारे में बोल रहा था कि फैमिली ने मुझे छोड़ दिया, छोड़ दिया, छोड़ दिया। हाँ, उसने ये नहीं बोला कि मुझे धोखा दिया, डिसेप्शन नहीं आएगा यहाँ पे, डिसअपॉइंटमेंट है। हाँ, फैमिली से डिसअपॉइंटमेंट है क्योंकि एक्सपेक्टेशन था कि पेरेंट्स और ब्रदर सिस्टर ने साथ में मेरे खड़े रहना चाहिए, बट मदर ने क्या बोल दिया था कि कोई किसी का नहीं होता। एंड आई न्यू कि मैं पढ़ा लिखा नहीं हूँ, ये तो सब अपने अपनी लाइफ में निकल जाएंगे, और वैसा ही लाइफ में हुआ। तो समवेयर देयर वाज एन एक्सपेक्टेशन। ऐसा नहीं हुआ, उसके साथ ये धोखा नहीं हुआ कि मैं तेरे को कल सपोर्ट करूंगा और फिर उसके बाद बैक फायर हुआ। therefore deception will not come over here। And yes, this is the totality, and Cilicia was given 200 single dose. After that, no other medicine is being required. In spite of so much of change of weather, he's settled and he's performing well. So this is the whole case of asthma, and now a differentiation of bronchus. Go and read Cilicia. This is a homework for you all, and enjoy the session. Thank you. Any other queries or any other doubts? Which,
Ma'am,
yeah.
ma'am, one query. If by treating for asthma and if patient gets skin problem like fungal infection, but the bronchial problem is same, slightly reduced, but gets the skin problem, is it a good good result, or we have to
No,
take the
no,
again
it
the
is not good
anti?
result, because see, I'm telling you one more important thing is कि when you're treating atopic, where IgE levels are very high, है ना? When you're treating such cases where IgE levels are high, and at that time, if you are treating and asthma reduces and complaints come over the skin, there the eruptions typically come over the corner of the elbows, the atopic dermatitis के जो symptoms होते हैं, वैसे अगर आते हैं, then it is a good sign. But if you're treating asthma and if fungal eruptions come up, then it is wrong, because fungus is goes towards syphilis somewhere, and really they are not a good sign. In any case, I have seen that fungus eruptions every time. Every eruption is not good. If it is so extensive that it is taking the pain, it has become bloody. And you all know that now funguses what are coming up are drug resistant. They are not even responding to any allopathic remedy. And fungus, as per I consider it, is a sorosyphilitic or psychosyphilitic, because once a fungus, where does a fungus grow is on the dead tissue and the dead cell. So somewhere the body is leaving the love of self. So definitely it is not a good sign. If asthma is going and fungus is coming, it is bad. If asthma is going and simple dermatitis is coming up, it can be atopic dermatitis also, then it is a good sign.
Okay, ma'am. Thank you.
If you are treating asthma goes and patient comes up with allergic rhinitis or with sneezing and all, it is definitely a good sign. I have a case recently which I'm treating. I gave the remedy. She had never eaten rice since 25 years, and I started her with rice. And at that time, also, I made a mistake in asthma. I gave a remedy as an acute. I did not see the patient, and on the phone, I had prescribed her. And after giving that remedy, the next day she came up was with vertigo, with ear numb sensation and blocked sensation in the ears and a complete nasal blockage. So this was again a bad sign. But after prescribing a right remedy, she said ki I am feeling very dyspneic, very restless, and she has taken the whole clinic over her head. But when I examined her, I could clearly examine and feel that now her lungs are absolutely breathing normal. The only problem she has is now of nasal blockages, which was not there before. And because she's so much anxious and she has suffered so much, her anxiety is so much overpowered that actually that anxiety was overpowering me also. So I tend to prescribe a wrong medicine. But then when I properly assess that my remedy was right, and after giving this remedy, this is a moon phase, and this disease has come from lower level to sorry, from higher level to a lower level, and the chest is absolutely clear, she can survive without an inhaler. Only complaint now is a nasal blockage. So my right remedy has really worked. Now she has started with nasal discharges with a thick greenish discharges, and she says after years I have got this coryza and I'm blowing my nose like a hell. And there are continuous discharges coming up. And this is a tray of this I can track that yes, I'm in a right direction. And her other pains have also reduced. That is also a very good case. Remedies, phosphorus दिया था तो it went wrong direction, then I prescribed ophidia. Chalo, let's call it a day. Thank you.
Thank you, ma'am.
I think
Ma'am,
it, yeah.
ma'am, is it the ringworm also be considered as a long sign in case if it is coming?
Ringworm, simple, tinea versicolor is not that bad. It is psychotic eruption, sauropsychotic eruption. But if it is tinea cruris, tinea capitis, tinea versicolor, versicolor, I'm sorry, then it is okay. Tinea
So
versicolor
even though,
is
even though if it
Shirni.
is an expensive one and the respiratory complaints improve,
No, tinea versicolor is still better, but I have not seen exteriorization coming up as tinea versicolor. I've never seen this. I have always seen that if it is badly suppressed, then definitely tinea cruris and tinea capitis do come up. But tinea cruris is really a bad sign. And the way tinea is spreading right now is really taken up as a psychosyphilitic disorder. It can stay up into your body for years together. So any fungal infection is not a welcoming sign. And fungal anyways is a sign of compromised immune system. Fungus don't grow on healthy tissues.
thank you, ma'am.
Thank you. So let's go. Let's call it a day. Thank you. Hope this case was very good. Thank you. I expect now wonders from your clinic coming up. And since next week we have we'll be completing 1 year of department. Matlab, I have no words for that. It is 1 year that sir has left us, but still he's there astrally with us, and I can feel the energies around us if you are working very hard. I expect all those people who are there with my sadhana series work harder, and sky's the limit for us. Just only thing is we have to stick up with our basic principles, cardinal principles. Don't leave it. I've accepted my fault, I left my cardinal principle, and what was the result? And if you are stick up with your cardinal principles, no one can beat you. Thank you.